Assalamu alaikum. So today we are back with the lecture number 6 of dental pharmacology series of lecture. So the topic of today's lecture is root canal therapy. Let's start it. Steps of the root canal therapy. First, we will discuss about the steps. So first step is basically we give local anesthesia. 2% lidocaine is given in the form of infiltrate or influent and alveolar nerve block. When you are giving infiltrate, basically it's given in the maxilla. The or purple anesthesia, it acts in 10 to 15 minutes. When you are giving inferior alveolar block, basically in the mandible, the purple anesthesia or purple anesthesia, it may work in 3 to 6 minutes. So then the second step is basically isolation with the help of by the application of rubber dam or cotton roll. The patient in this step, basically the patient is protected from laceration by the instruments, or the risk of aerosol is minimized, and from swallowing or aspirating instruments, and the risk of aerosol is minimized. Okay. The third step is access opening. In this step, what do you do is you with the help of Fisher burr attached with a high speed handpiece, we get a straight line access that extends to the surface of tooth to the pulp chamber. Okay. We find the canals with the help of probe, and we remove the chamber roof and do the pulpectomy. Okay. So this is rubber dam. You can see in this picture. It is why it is used. Basically, it is used for the isolation, and it minimize the laceration with the help of the instruments. Okay. Then working length. The next step is working length. What we do is we find working length. How it is find? Basically, the file is placed in the canal and the radiograph is taken. Okay. And the tip of the file 1 millimeter is short of the radiographic apex. Okay. Stopper should physically contract in the coronal reference point. Okay. Cleaning and shaping of the root canals. Basically, it removes the necrotic pulp. Shaping involves enlarging the canals with the help of files in order to create flared preparation that is most favorable for procedures like sealing and obturation, etc. Okay. And the last step is and the second last step is irrigation lubrication. Clean out the during cleaning and shaping for the chemical cleansing. Application of canal medicaments and temporary filling is done. Okay. On the second appointment, what you do is removal of the filling, which you have done temporarily, and drying of canals with the paper points. Then the application of sealer using the endomethasone. Filling of canals with gutta percha. It comes with free-form cones whose dimension match the size of the cells when that have been used to prepare the canal. These are the paper points in different forms, in different numbers. They come 10, 15, 25, 20, 30 numbers. Okay. These are the GP points, gutta percha point. Okay. These are the K files. There you can see there. They are also in different colors as well as with different numbers. Okay. uh, so this is the a little bit summary of a root canal treatment. In this picture you can see is in the first picture in the first picture, there is a decay in the tooth which has led to the pulp, and the infection has led to the abscess in form of abscess. This is infected tooth. Then what we do is in the first step of root canal treatment, we make a opening with the help of table fisher burr, and then in the third step, infected tissues were removed with the help of the endodontic file, and the canals are clean. Okay. In the fourth step, what we are doing is canals which we cleaned earlier are now filled with the permanent material gutta percha. Okay. And in the fifth step, you can see is that a post is placed with the help of a filling as well. Okay. Per- Permanent filling. And then in the sixth step, the new crown is placed where you have earlier you did a filling. Okay. So in this picture, it's quite a similar. You can see this. So abscess tooth, you cleaned it, remove the pulp, and place the post here, and then you did the coronal filling here and obturated the tooth. So accepts opening for the maxillary teeth. These are like these things, and accepts opening for the mandibular teeth. These are the accept opening for the mandibular teeth. Okay, so what are the pharmacological agents used in the root canal treatment? There are irrigating solutions, there are chelating solutions, there are intracanal medicaments. Okay, what are the irrigating solutions? Irrigating solutions include distilled water, saline, sodium hypochlorite in conjunction with hydrogen peroxide or EDTA, 30% solution of urea, solution of chloramine. Okay, saline Basically, it is isotonic with the tissues, does not have antimicrobial effect. Ideal properties of the irrigation solution includes organic tissue solvent, inorganic tissue solvent, antimicrobial action, non-toxic, low surface tension lubricant. So we will discuss about sodium hydrochloride. Basically, it is the most common irrigant known as household bleach as well. Okay, most common ingredient is sodium hypochlorite, is also known as household bleach. Mechanical flushing of debris from the canal, low surface tension, so dissolve organic tissue in the canal. Antimicrobial lubricant mechanism is free chlorine in the NaOCl dissolves necrotic tissue by breaking down the proteins into the amino acid. Thus, is a reducing agent. Destruction of bacteria takes place in two phases: penetration into bacterial cell wall, chemical combination with protoplasm of the bacterial cell, and destruction. Okay, 0.5 to 2.5% concentration. 2.5% means which decreases the potential for toxicity yet maintains tissue dissolving and antimicrobial activity. Clear straw color solution. Okay, basically the clear straw color solution. Unstable when diluted, so store in cool place and protected from drying. 5.2% solution dissolves the entire pulp in 20 minutes to 2 hours. Disinfection is initially slow, but it increases rapidly. Placement into canals. Irrigating needle is placed loosely into the canal. Irrigant does not move apically more than 1 millimeter beyond the irrigation depth, so deep placement will with small needle enhance irrigation. During rinsing, needle is moved constantly up and down to produce the agitation and prevent binding of the needle. Okay. Combination of NaOCl 2.5% and hydrogen peroxide 3%. The effervescent with it mechanically bubbles and push debris out of the root canal through the least resistant orifice into chamber. The solvent action of the sodium hypochlorite on the organic debris of pulp tissue, the disinfecting and the bleaching action by the solution. Always use NaOCl at last because hydrogen peroxide can react with the pulp debris and blood to form gas. Any type gas within the tooth will cause continuous pulpal pain. NaOCl is used after the irrigation of the root canal with EDTA, which removes the smear layer. So this is a very important point. Chelating agent. What are the chelating agents? The EDTA you use is RC prep. EDTA chelation is the binding or complexin of a bi or multi dentate ligand. These ligands, which are often organic compounds, are called chelants. Chelators, chelating agents. Purpose is lubrication, emulsification, holding debris and suspension. Formulated for clinical use and can be selected in either or a viscous suspension or aqueous solution. This discourages tissue adherence and accelerates emulsification by leaving a favorable pilot hole, which facilitate introduction of next sequentially large instrument. Chelators are used for shorter periods of time as their protected use can soften dentine and predispose to iatrogenic events. So basically, when you are doing a root canal and when you can't find a canal or when there is lost canals, you apply the chelator, and one of the example of the chelator is EDTA. So this is the one thing that I used to do during my house job, and right now doing in my clinics as well. I used to do this technique, and this really helps. What I do is I apply a little bit of chelator on the file, and then I place it into the canal, and all the block canals or closed canals are eventually opened down. So it is a very good trick, and it is a very good hack as well. Okay, so EDD is 17%. I was talking about, it is relatively non-toxic, only slightly irritating in weak solution, form highly unstable solution. Metal chelates in the combination with heavy metals of alkaline earth functions by forming calcium chelate with a calcium ion of dentine. Dentine thereby becomes more friable and easier to instrument. So this was the point I was talking about to you earlier, that because of EDTA, it becomes very much easy because dentine becomes very much friable and it is very easy to instrument. Okay, what are the effects of EDTA irrigation to remove the smear layer by softening of renin? This is the point I was talking. And it is antimicrobial. Extent of demineralization of EDTA is proportional to exposure time. In 5 minute demineralization is 20 to 30 micron depth in renin. This is a thing capable of moderate degree of irritation. Placement to the canals, it is basically inserted by the depositing a few drops in pulp chamber with a syringe or plastic pipette and carefully pumping the solution into the root canal with a 5 root canal system. Okay, EDDX, its salts may be used to chelate calcium ions of the tooth structure as decalcified dentine. The formula is a disodium salt of EDTA, distilled water, sodium hydroxide, and it is desired 0.84 gram of the disinfectant Catavlon is added. This 15% solution of EDTA with pH 7.3 with Catavlon RC prep, a combination of EDT and urea peroxide, vicious chelator and best for holding debris in suspension. Also, lubricant for root canal. Encourages the flotation of pulpal remnants and dentinal mud, which reduces the improbability of blocking the canal. Intracanal medicaments used as the interim appointment dressing to reduce the inter-appointment pain. The thing is to decrease the bacterial count and regrowth and to render the canal content inert. What are the intercanal medicaments? Basically, phenolics includes camphorated mono, perchlorphenol, eugenol, cresol, cresostort, thiamol. Aldehydes include formoscurol and glutaldehyde. Halides includes NaCl, Kl, steroids, calcium hydroxide, antibiotics, and combination. Phenols and aldehydes, non-specific action destroy the host tissue, do not reduce the inter-appointment pain. Calcium hydroxide. This is very much important because effective. It is effective in inhibiting microbial growth in root canal by alkaline pH, dissolving the necrotic tissue, release of hydroxyl ion, low solubility, slow releasing system in the root canal. Physical obstruction of canal, block accumulative of exudate, reducing the potential for nutritional support. It is recommended for use in teeth with necrotic pulp tissue. This is a very much important point. Okay, in the necrotic pulp tissue, we use calcium hydroxide, and it is available basically in two forms, basically in dry powder mixed with liquids such as anesthetic solution, saline, water, glycerine, or proprietary paste supplied in a syringe. And it is basically placed into canal with the help of lentulo spiral. This is also an instrument. This is just like a file, but it is with the help of this we can place calcium hydroxide into the canal. So other include CMC hydroxide. It is loses much of its activity in 1 to 5 days. Weber forming medicament applied on the absorbent paper on cotton pellet and placed in the pulp paste. Potassium iodide, excellent antimicrobial activity and minimal activity, loses the activity in 1 day. We can apply the corticosteroids. These are anti-inflammatory, reduces the post-operative pain, and used in irreversible pulpitis and acute apical peritonitis. And we can also apply the chlorhexidine 2% gel or mixed calcium hydroxide. The activity is greater, doesn't remove the smell layer. So with the help of this, our today's lecture is over. I hope it was audible to you guys, and thank you very much. Allah Hafiz.